I have the next question. I'm Cayetana Lascano. I'm a second-year med student at Ponce Health Science University in Puerto Rico. And this question is for Aron and Dr. Berland. And it's, what are your favorite and least favorite aspects of your career in vascular surgery?
I think in terms of my favorite, it's got to be, from what I've seen, it's got to be the long-term relationship with patients. I just think that going into this, I seriously looked at hematology oncology for a while, just for that sort of long-term steady relationship. And that's something that I was really looking for in a more procedural field. And that's something that I was able to find here. I know Dr. Rajani said we're not primary care doctors, but I do think it's cool how you get to see patients again, regularly, every couple months, every year, follow up with them, and also get to operate. And I think marrying those two worlds sort of perfectly is probably my favorite thing about vascular surgery. As for least favorite, I think I'll defer that to my more experienced colleagues.
No, that's a great question. There's a lot of things that I like about it. One of my favorite aspects is that you're the surgeon's surgeon. So when we get called for emergencies, it's from other surgeons, whether it's neurosurgery doing a spine exposure, GYN doing something with the uterus. These other doctors get into bleeding, and who do they call? They call vascular. That's really cool when you're the person that comes in there to fix that hole in the artery and save the day. That's also my least favorite part of vascular surgery, because that never happens at a time when you want it to happen, right? These things just pop up. You never really know when it's going to be, and it's never the right time. But you kind of drop what you're doing, you prioritize, and you kind of take care of these problems. And it's really cool to be empowered and have the knowledge and skill to be able to fix holes in arteries that otherwise would kill a patient. So that part's really cool. Secondly, the technology. I mean, if you have any inclination to love the tech, vascular surgery kind of has, an exploding arena between stenting, drug-coated technologies, different delivery devices, and there's incredible opportunities to collaborate with industry to really advance the science. So if you're into that kind of thing, you're doing these procedures, you're hands-on, you're in the OR, you're doing these procedures, you've got the ideas to make things better, faster, slicker, and by working with industry, you can kind of make these things happen pretty quickly. So I think that's one of the best parts of vascular is the technology.